Hello, my name is Bimbai. I'm an occupational therapist. I work in a senior living facility. My presentation is on adult learning theory by Malcolm Knowles, also known as andragogy. Lee reported in 1998 that andragogy is a term used to focus on the characteristics of an adult learner and a set of assumptions most effective at teaching adults. Here is an outline of my presentation. I will give the history of andragogy and Malcolm Knowles, and then the assumptions made by Knowles about adult learners, how adult learning theory is applied in healthcare education, and a critical analysis of the theory, and then a conclusion. According to Lee in 1998, Malcolm Knowles was considered the father of adult education. He died at the age of 84 in 1997. He authored 20 books. He contributed to workplace learning. Malcolm Knowles was a director of adult education at the YMCA at Boston University from 1960 to 1974. He prepared about 200 adult educators around the country. Knowles presented the assumptions on adult learners in 1970. That differentiated how adults learned was different from how children learn. Conaway in 2015 reported that before andragogy, how adults learned was the same as how children learned. This is referred to as the pedagogy process of learning. Until Malcolm Knowles presented andragogy in 1970, there was only one model of assumptions of learning, which was pedagogy, Knowles reported in 1980. Pedagogy means the art and science of teaching children. The economic and political changes of the 20th century required adults to learn expediently, and the pedagogical model did not seem to fit adult learners' needs, reported Malcolm Knowles in 1980. The assumptions and the characteristics of an adult learner are self-directedness, the role of experience, readiness to learn, orientation to learning, and motivation. I will discuss each of these characteristics, starting with self-directedness as it relates to self-concept. As a person matures, one moves from dependent to independent toward a self-directed being, said Pappas in 2013. Conaway in 2015 reported that self-directedness develops with age. Maturation occurs at different rates for different people, wrote Knowles in 1980. It is assumed that adults perform best in an autonomous, self-directed environment, Conaway stated in 2015. Experience. Adults' life experience becomes a learning resource, wrote Battle in 2021. Adults have different backgrounds and can relate new experiences to past experiences, stated Knowles in 1996. Learners can learn from each other's experiences. Adults learn when it applies to social roles, reported Battle in 2021, Conaway in 2015, and Knowles in 1980. For example, adults are willing to learn if they know that the outcome will have tangible results on their social roles as a spouse, parent, or employee. Orientation to learning. Knowles in 1980 reported that learners learn to achieve competency and their full potential in life. Adults have an immediacy of application of what they know. Adult learners want to apply what they learn to their immediate life problems. A problem-centered approach is preferred by adult learners versus subject-centered. Motivation. Knowles in 1996 stated that learning is a process of meeting or achieving a goal. As an individual matures, motivation to learn is internal and controlled by the learner. adults are intrinsically motivated. According to Battle in 2021, the Adult Learning Theory by Knowles is a highly influential guide to practice. Allen in 2016 reported that the predominant paradigm in psychology shifted from behaviorism to constructivism in the 1970s. Knowles translated constructivist insights into a new teaching method, emphasizing collaborative, interactive learning experiences and application of curricula to real-world problems. In the following slides, I will discuss the studies done in healthcare education using the adult learning theory. Laidley and Braddock in 2000 used the adult learning theory to create a framework for practical approaches to teaching ambulatory medical residents. The adult learning theory's teaching process included eliciting the medical residents' ideas, promoting teaching interaction, involving students in assessing their knowledge, and preceptors intervening to correct knowledge gaps. Strategies also included allowing residents to apply new knowledge and to perform self-reflection. Educational contracts allowed students and educators to negotiate and agree on specific goals and objectives. Students were deliberately involved in their evaluations to set personal goals and reflect on achievements. Laidley and Braddock in 2000 concluded that adult learning theories could be used to evaluate the effectiveness of strategies for teaching medical resident students in ambulatory settings. The challenges encountered using the adult learning theory were that some learners could not determine their own learning needs. According to the adult learning theory, learners can decide on their own learning needs. Integrating students and educators' perspectives on educational needs can improve teaching and learning effectiveness. Laidley and Braddock in 2000 reported that another weakness of the adult learning theory approach was that some students could not define appropriate learning goals. Some students do not recognize their limitations in their knowledge. Some overestimate their competence in evaluating and managing patients. Students must be able to accurately assess their learning needs before they can set educational goals. Another critic was Bleakley in 2006. Bleakley in 2006 critically addressed the limitations of adult learning theory in teaching medical students. He argued that adult learning theory fails to explain how learning occurs in a dynamic, complex system in a fluid clinical team. Bleakley argued that adult learning theory focuses on an individual and not on the context of learning. Sheshorn reported in 2008 that andragogy does not consider the context of education and other factors such as life experiences, gender, and culture have an impact on learning. Bleakley in 2006 gave an example that a poorly performing medical resident may be self-directed and not recognize their mistakes. The use of socio-cultural models would be more applicable. In socio-cultural models, cognition is distributed among people who make up the community rather than individuals. Peer feedback would be more appropriate rather than self-assessment. The next slides provide positive results on the use of adult learning theory in healthcare education. Halalu and others in 2017 developed an evidence-based medicine curriculum based on adult learning theory and tested its effectiveness. The curriculum was structured to residents' characteristics as adult learners. The study used minor interactive discussion groups and patient-oriented research studies. using the adult learning theory to design evidence-based medicine training for medical students successfully increased medical residents' comfort with evidence medicine concepts. After the study, self-reported application of the evidence-based medicine training skills increased. Before the study, only 10% were using the medical journals as a source of knowledge. After the study, 100% were using evidence-based resources as a source of knowledge for patient care. The study reached 3 learning outcomes. Residents positively changed their attitudes about the use of evidence-based resources. Residents reported being more competent, and there were gains in cognitive learning. Battle in 2021 reported that Knowles' adult learning theory is still questioned whether the idea is empirically valid. Bleakley in 2006 stated that Davenport challenged andragogy as unfounded and lacked conceptual basis and empirical evidence. Meyer in 2020 examined Knowles' principles through an empirical study. Meyer's study investigated the relationship between age and the need to use adult learning theory methods. The adult learning theory by Knowles is criticized for not defining when an adulthood begins. The typical age of the legal majority is 18. The study's results showed students younger than 28 years were unprepared for adult education. After 28, adult education methods seem to be generally acceptable. Students who attend college are in their late teens and early 20s. The study confirmed the delay in maturation. The study's results suggest the methods of adult learning principles seem to be generally be acceptable after age 28. The results of the survey by Meyer in 2000 confirmed that older adults rated adult education methods significantly higher than younger adults. The study's findings supported the principles of adult education by Knowles that andragogy depends on age. It is important to note that young adults less than 28 years are not necessarily ready for adult learning methods. Adult learning principles to online learning. The online learning environment was not present when andragogy was developed. Yet the universal nature of the theory enables educators to use them in online environment, said Chechon in 2008. Andragogy experienced a resurgence with a rise in online learning, said Battle in 2021. Colleges developed more distance education programs targeting non-traditional learners in the 1980s and 1990s. There is a rise in online learning. To succeed in online learning, learners would need to cultivate self-directedness. Allen in 2016 reported that technological innovations such as video conferencing and real-time chat had allowed educators a broad array of tools to personalize learning and make the goals of adult-centered learning approach possible. More empirical research is needed to refine the proponents of adult learning principles and to develop an overarching theory of adult learning. Chechon reported and compared 3 theories about online learning: andragogy, experiential, and transformative theory in designing online programs for adult learners. Knowles' theory of andragogy was found to be the most comprehensive. The author concluded that no single idea could explain how adults learn. There are many theories, each has its own strengths and weaknesses. Each person is an individual, and everyone is different. All the theories have something to offer educators, which include flexibility, self-direction, learner-centered approach, and recognition of the importance of a customized approach to learning. Instructors need to consider the culture of the society of the adult learner. I will conclude my presentation. Malcolm Knowles presented the adult learning theory in the 1970s. It was embraced by educators as the traditional pedagogy had failed to engage the adult learners, said Allen in 2016. The characteristics of adult learners as described by Andragogy are adults are self-motivated, self-directed, have a problem-based approach, and bring a reservoir of experience that becomes a resource for learning, reported McDougall in 2015. The principles of adult learning emphasize the importance of collaborative and interactive learning experiences and application of curricula to real-world problems. The most implicit criticism of andragogy is that no empirical testing has sufficiently verified Knowles' claims on andragogy, reported Battle in 2021. More empirical research is needed to refine the assertions of adult learning theory. There are some empirical studies that support the use of the adult learning theory in healthcare education. Online learning is on the rise. The universal nature of the theory enables educators to consider it for the online learning. Thank you very much. And here are my references.